to the new episode of the Nclex tutorial session. This will be the first Nclex tutorial class at Dartness. Our focus today is to treat those questions that are related to the pharmaceutic phase of drug action. We have treated the pharmaceutic phase of drug action in our pharm class. I implore all of you to watch the video on the pharmaceutic phase of drug action on our website www.dartness.org, Facebook, Instagram, Twitter, and TikTok. Let's read the question. Question 1. A nurse is administering an enteric-coated aspirin tablet to a patient. What should the nurse include in the patient education? As per Nclex rule, you need to read the question twice. I will give you some time to read the options. What are the keywords in this question? There are two keywords we need to take note of. There are two keywords in this question. One, we have an enteric-coated aspirin tablet. Two, we have patient education. What are the principles that guide the administration of enteric-coated medications? First, let's talk about what an enteric-coated drug means. Enteric relates to the small intestine. Coated means something that is covered with a coat. So, enteric-coated medications are meant to be disintegrated, dissolved, and absorbed in the small intestine. Why? Because they need an alkaline environment for their disintegration, for their dissolution, and for their absorption. Small intestine is an alkaline environment. Stomach is an acidic environment. So, enteric-coated medications cannot be disintegrated, dissolved, or absorbed in the stomach because of the acidic content of the stomach. Number 2, enteric-coated medications should not be crushed, chewed, because crushing them or chewing them exposes the stomach to the medication. And when the stomach lining is exposed to these medications, it can cause irritation of the stomach lining. Number 3, crushing or chewing the enteric-coated medications before swallowing can reduce the effectiveness of these medications because they still have to pass through the stomach, and stomach is an acidic environment. So when you crush or chew these medications, they are already mixed with the acidic content of the stomach, and that will reduce their effectiveness. In that case, you should not crush or chew the enteric-coated medications. Examples of enteric-coated medications include the aspirin, the omeprazole, esomeprazole, and so on. So understanding the principles that underlie the administration of the enteric-coated medications will lead us to choose a correct answer. Now let's look into these options. Don't forget, you are giving patient education about the enteric-coated aspirin tablet. Option A says you can crush the tablet if you have difficulty swallowing. If you could remember that enteric-coated medication should not be crushed or chewed. That will lead you to believe that option A is not correct. Option B, take this medication with food to improve absorption. Number 1. The question is, where does the absorption of the enteric-coated medication take place? It takes place in the small intestine. And when we eat food, they have to spend some time in the stomach. So if you take these medications with food, remember that food will cause a delay in gastric emptying, a delay in stomach emptying. And when there is delay in the stomach emptying, that will also slow the movement of the enteric-coated medications to the small intestine, where they are meant to be disintegrated, dissolved, and absorbed. Food in the stomach will delay the stomach emptying, thereby slowing down the movement of the medication to the small intestine, consequently resulting in the delay in disintegration, dissolution, and absorption. So option 2 is not the right answer. Option C says do not chew or crush the tablet to ensure proper absorption. Of course, option C obeys the principle of the administration of an enteric-coated drug. Option D, this tablet will dissolve quickly in your stomach. Understanding that enteric-coated medications need an alkaline environment to dissolve will lead you to believe that option D is wrong, because enteric-coated medications do not dissolve in the stomach, because stomach is an acidic environment. They need to be present in the small intestine, that is an alkaline medium, for them to be dissolved and absorbed. So option D is wrong. So the correct option is option C. Let's read question 2. A nurse is caring for a patient prescribed